So now you're pregnant again, but this isn't your first rodeo. You've been pregnant before. You know lots of the things to expect, but there are some different things second time around. The more you have, the more you get used to it, but there's always a difference for each pregnancy. So let's assume that you have a small child at home and you're pregnant again and you're trying to remind yourself, well, what do I need to pay attention to before I even get to the physician? Well, remember some of the important basics. You've got to cut down on your caffeine. We know that 5 servings of caffeine is linked to miscarriage, and there is no established safe amount, but generally speaking, 1 to 2 seems to be working okay. Remember, a very giant coffee is not 1 serving, so 5 servings is 8 ounces of coffee, or 1 soda is considered a serving. Also, you want to get on prenatal vitamins as soon as you can. They're really important early on. Prenatal vitamin with folic acid helps reduce the risk of birth defects. And you want to take a quick review of the medicines you're taking. There's another video on medicines in pregnancy, but remember to stay away from the non-steroidal anti-inflammatory drugs like Advil, ibuprofen. There are some medicines that you want to continue that if you're on, because if you stop them, then that's a problem for the pregnancy. For example, thyroid medicine. Okay, so other medications can cause birth defects or miscarriage, increase the risk. Thankfully, there aren't too many, but there are some medicines for anxiety, depression that may increase the risk slightly of some of those issues, and so you want to speak with your doctor and have those medicines reviewed even before you get your visit. Okay. So what's different? Well, one of the main differences, for your second pregnancy, is all your symptoms come earlier. You'll be more tired. You'll have more nausea, perhaps. You'll have more backaches. They'll occur earlier. You'll feel more pressure. So generally speaking, the second pregnancy is harder, but the delivery is easier. You've been there, you've done it, you know what to expect. So why is the pregnancy itself harder? Well, because you have that first child. That wonderful first child you have demands a lot of your attention and your time, and it prevents you from resting when you feel, she or he prevents you from resting when you feel like it, when you want to take it easy, when you want that nap, when you want to eat the right thing. And so I want you to be careful about that. And if you're really having a hard time, that's when it's time to call in the father of the baby, or your parents or his parents, to help out, to give you a break. And you're not a bad parent if you need a little bit of break from your little one to take care of the new one that is incubating inside of you. So I hope you found this helpful, and I'm sure you'll find hopefully some other useful information in all the other videos that we have for you. Thank you.